Hey guys, Dr. Pavlak here from Physio Orthopedics and Performance over in the Valley, Merriman Valley in Akron. Talking shin pain today. 3 factors that go into shin pain: decreased ankle range of motion, overtraining, which is more related to coaching and how much you're doing throughout the day, and then last 2, collapse of the foot. So if you have flat arches, if your calves or ankle are tight, or if you're doing too much, you have a higher risk of shin splints or pain into that medial or anterior portion of the shin. We're going to go over a couple things to help decrease that pain and get you on the right track. The first part of this equation is the proper warm-up. So we do a couple motions to activate the muscle outside of jogging. You can do heel walking, walking on your heels, turn on the anterior tib, toe walking, turn on gastroc, or bent knee toe walking, turning on that soleus area, and even rotating through from heel to toe and from toe to heel back and forth and turning on those muscles. Each movement can be done for about a minute or so before moving on to the next movement. You should feel those muscles start to warm up and get some blood flow there over time. The next category would be prevention. A couple of movements. Number 1 would be traditional eccentrics, where you would go up on 2 feet, you would shift to 1, and you would slowly lower to the ground. So you can see my heel up on 2, shift to 1, slowly lower to the ground, like a 5-second count. You could then take a ball, you could pinch it between your heels, you go up on 2, slowly lower to the ground, 5, 4, 3, 2, 1. And both of those would be helpful, and even doing that heel raise eccentric with your knee bent. So up on 2, shift, bend the knee, 5, 4, 3, 2, 1, lower that heel to the ground. And what that does is that strengthens the muscles that absorb your body weight, and that would be preventative, something that could be done after practice on your off days. Questions about icing for a cool down, and icing is great to do if you do it within 30 minutes to an hour after your exercise session. Icing later on in the night may not do a ton, or can be counterproductive when you're talking about dealing with inflammation. We also have a couple of movements that we'll talk about here in a second that go through and help you relax the muscles out and force out that inflammation as well. That last category we discussed is the cool down. You would need some sort of ball, a stick, rolling stick, and compression floss, also on Amazon for maybe $5 to $10 each, not too bad. After practice, as your cool down, you can go through and with your knee bent, get into that tight calf muscle and into that back, and into that tight shin muscle into the front, and roll out those muscles, maybe 60 seconds each muscle, and they should get less tender over time, not more tender, so you're not pushing super hard. You could use the ball, and not on the shin bone, but right at that medial side where you find tender spots. Go through, find an area, pin it down, and gently massage out that tight muscle post-practice. Or even going through and using compression floss, where you take that compression band, you would start at the ankle, and you would go 50% stretch, and you would completely overlap the muscle so you can't see any skin. And wrap that area nice and tight all the way up that shin bone, and then go through and do ankle range of motion back and forth. You can wear that for 1 to 5 minutes as well. And all 3 of those things would help to cool down your body until your body is time to switch into that parasympathetic mode, where the muscles are turning off and you're trying to prevent injuries by cooling down your body. All those things would fall into categories that would help to deal with shin splints or help decrease pain. Obviously, if you have specific questions, feel free to contact me. My email is drpavlak, P-A-V-L-A-K, @physio-orthoperform.com, like the website you'll see on your screen.